I'm going to be talking a little bit today about sex education, sort of in the context of LGBTQ plus folks, because it is Pride Month. So happy Pride! My name, as Beverly said, is Eileen Crehan. My pronouns are she, her, hers. I'm a clinical psychologist by training. And this is my area of study. So I'm really excited to be sharing this information with you folks. And we'll leave some time for questions at the end. So certainly if you've got the questions that you're burning to have answered, I can try my best towards the end of the hour. Okay. All right. So for today, I'm going to hit on three big areas. So first, how is sex ed delivered by whom? And we're going to talk a little bit about sort of the literature and what we know in the field generally, but also specifically work we're doing in my lab. How does identity intersect with sex ed access? And the spoiler alert, it limits it oftentimes. So we're going to talk about what drives those limitations to access. And then how can we make positive changes? Hoping we can end on a positive note. I want to pop this up right at the beginning. This is not a graphic that I made, but this is a good guide to some of the terms that you'll hear come up during the presentation today. I shared my slides with the team, and so those will be available, I believe, after the webinar. So if you ever want to go back and look at this, but the gender unicorn gives some really great definitions of gender identity, gender expression, sex assigned at birth, sexually attracted to, and romantically emotionally attracted to. This is available in a whole range of language. So if this is an area that is new to you and you're trying to learn some of the key vocab words, this is a really good place to start, right? So generally, it's a big concept. We could spend a whole training just on, talking about these definitions, but gender identity being how someone thinks about their gender, and gender expression being how gender is presented, so maybe in the way that you dress. Sex assigned at birth, we tend to think about chromosomes, or so what people are born in their genetics, but not just in those female and male buckets, that there are lots of variations in our genetic information about sex, actually. And then who people are sexually attracted to or romantically and emotionally attracted to. So, folks that are not you, who you're interested in. So brief rundown of some terms you'll hear come up today, but definitely check out this resource. It's www.transstudent.org/gender if you want to look at that for a little bit longer. Okay. So briefly, my why, right? So I call this talk "Who's Afraid of Sex Education?" because what we're finding is that when we survey parents of anyone, right, whether or not they have autism or not, parents are really enthusiastic for their kids to get some sort of sex education. But the problem that we run into is that topics are sometimes considered scary. There's a lot of stigma behind them. We don't know how to talk about them. Things come up in hushed tones. And then as a result, study after study shows that autistic adolescents and adults in particular have less access to this really important information. Studies also show that LGBTQ plus individuals have less access to appropriate sexual health information, and certainly folks who have both identities then experience this double miss of information that's going to be most helpful for them. So I run a bit optimistic by nature. So part of what I really like about this work is that I think this is obviously a research topic that's important, but that it's a human rights question, right? That we, should know how to operate our bodies in relation to ourselves, in relation to other people, however we may choose to do that if we're not harming other people. And that the right to autonomy, right, to make your own decisions, is a really important one, and that historically has been overlooked, especially for folks in the disability community, right? So that, those people don't need and to learn about sexual health is a really outdated view. And so part of what I like about this work is trying to push back against some of those myths, which some still persist in some areas, but I think we're making some positive change. And then the last reason is safety. A lot of the reason that people look into sex ed in the first place is to protect themselves, or their children, depending on the role of you as the listener, about things like abuse, but also for things like mental health is really important. If we know how to operate our own bodies and make our own decisions, we're more likely to be able to, have healthier sort of space in our minds. And I think that sex ed is a really good tool to achieve some of these, to help with that. So that's why I do that. This is why I keep coming back in and chatting with the group about this. And the topic, sexuality and relationship education, or sex ed is a little bit easier to say, covers a few main topics. These are the common ones that I hear about when I do trainings in schools and with medical centers and other professionals. And these are the big topics that come to mind, which are certainly important and really great. but sex ed is a really big topic. There's lots of pieces that could get covered or should get covered depending on where you are. And there are standards for this. This isn't something that we're sort of just making up. The national sex ed standards are the starred content here. So anatomy, contraception, boundaries, puberty, STIs, reproduction, consent, and LGBTQ plus identities. And what we're finding is that there's a little bit of a limit to the type of information that people think of when they can think about sex ed, and that it's really focused on physical health. We did a survey last year in our lab of autistic adults and neurotypical adults and asked them retrospectively about their sex ed experiences. So we had about 140 adults respond in total from all across the US. And we said, okay, which topics would you like to learn more about? And we asked about a whole bunch of things that were on the previous screen and some other fun areas. And what we found is that the autistic adults wanted more information than on these four topics than the neurotypical adults did. So sexual orientation, gender identity, consent, and assertiveness, right? These are really socially laden topics, right? So for something like, I think the classic example when we think about sex ed, people picture putting a condom on a banana, right? That's not actually a very big part of my day job. Okay, I don't actually teach that skill that often. It's more about the social pieces and identity that go along with figuring out who you are as a person, in relation to other people. Um, and so we're completing another round of data collection this upcoming year, where we want to look specifically to see if these differences exist also for LGBTQ plus adults, and then whether or not they have autism. But we know that these things can be challenging to teach because they're not always considered like the most important. We sort of head toward the contraception and safety pieces first, which are still really important. But topics like consent and assertiveness are going to be hugely important when we're talking about relationship building with other people, right? I'm sure I don't need to say that to you folks. So then how do we get this information to people? How is sex ed delivered? I would say generally, inconsistently, I think would be the answer to this question. So in the United States, there are not federal guidelines about what should be included in sex ed, what has to be offered, who teaches it, anything like that. So we know that there are lots of ways for sex ed to happen. We can think of formal instruction methods where you maybe sit down in health class and today you learn about the different sexually transmitted infections. But there's also a lot of informal ways that sex ed gets learned. So families are a huge source of this, right? Whether it's through direct questions and teaching, whether it's through a parent leaving, a book on a kid's bed. Media is another one. So this can be social media where people are listening to people talk about this, but also, watching a movie. And this can overlap with family, right? If you see something romantic happening in a movie and talking about what was that and what did that mean? And then peers, right? Especially for the more social pieces, sort of like identity and dating, we learn a lot about relationship building from watching our peers, either in their successes or their failures, right? But we're collecting all of that information. We're good social scientists as we're moving through our day. So I wanted to share this chart, and this is about half the country on this, from Psychus, which is a US-based sex education organization that summarizes what the guidelines are for sex education across the 50 states. So if you'll notice, I'm seated up in Massachusetts. So hello, if I have any fellow Boston pals up here. If you'll notice, Massachusetts has a whole lot of blanks, which as a researcher up here is a little bit of a bummer, right? So sex education is not mandated. HIV, STI education is not mandated. Healthy relationship education, not mandated. It is up to the individual school boards, okay? The other thing that I think is really important to highlight is on the right side of this chart. These are all, if sex ed is offered, these are rules in place in these states that say, okay, if you offer sex education, it has to be age appropriate, evidence based, culturally appropriate, medically accurate. And if you'll notice, all of these are important, right? As a researcher and looking at how we use evidence, there's not a lot of boxes checked in this evidence-based chart, right? These requirements, it's regardless of whether or not a kid is in special education. All students should have access to this information. And then it gets even more challenging for people providing this education when they're working with folks. Let's say you have a kid with a developmental disability who has really limited language. And so the usual tools that they would use to teach sex ed, let's say to an eighth grader, might not be accessible because it's all written. Um, there's a lot of room for improvement in this area, right? And so this is something that we're working on in my lab, is how do we better prepare, providers and important adults in people's lives to help share this information, when kids need it. There are good, or I guess better, models for sex education in other places around the world. So, for example, in the Netherlands, they start a sex education program when kids begin school, which is really the dream, right? If you think about some of these social constructs in particular, if we're talking about consent or sexual orientation, these are not terms where you're like, okay, I'm going to give you a brief definition and that's all you'll need to know for the rest of your life, right? There's a lot of nuance in that. It's for consent, it's learning how to recognize what you want to do and giving that information to other people, reading and accepting, consent from others who are, in front of you. For sexual orientation, understanding what that means for you, that it might change over time, how that fits in with your family and friends. So there's a lot, I think, of expectation that you have that time when you're in middle school or high school, and you'll be taught this information and you'll be armed with it for the rest of your life. I don't think it's that realistic a model, but there are some other countries that do it in different ways than the U.S. does. I think we could learn some interesting lessons from. Um, the other thing to think about, especially when we're talking about LGBTQ plus relevant topics, is that the family values where folks are coming from are going to make a really big difference. If you have a family who's really supportive and like, hey, your identity is your identity, just let us know, then perhaps kids will have good access to good information. What we find sometimes is when families are not accepting of that, that creates a lot of risk for mental health difficulties, because that's really upsetting for kids to get kicked out of their homes, which is a really big problem. And you can imagine, for autistic youth in particular, that process of coming out, especially if it is not received well in the house, is going to be extra challenging, because then other people to sort of provide resources might be harder to find, because that intersection of autism and LGBTQ plus resources is such a small pile, such a small area. And this is something I mention oftentimes in trainings with parent groups as well. There have been some really interesting and important studies that show that rates of identities like lesbian, gay, bisexual, transgender, bisexual are slightly higher in autistic populations. So the fact that we're not great at teaching information about LGBTQ plus topics is particularly problematic for autistic learners, because they might be more likely to need that information. So we would like to rely more on families in this area, but it comes with some extra challenges to make sure that support is there and that kids are safe. The peers piece of this, if kids are socially isolated, they might not have as much access to that. So how do we augment that? How do we make sure they get that information if they're not connecting with peers, when they're ready for that information, right? We also know that even the presence of a gay-straight alliance in a middle school or high school can reduce the risk of bullying for kids who identify as LGBTQ. So those are, we can take this information and talk about how we can make better environments for kids to learn, the information that they need to, but also to have, social supports and friends so they can navigate adolescence safely and in a healthy way. Okay. And then media. So there's a lot of information that is accessible online. In some ways, that's great, right? If you are someone who has questions about your identity, and let's say you're not in a family setting where you feel comfortable asking those questions, you can go online and maybe find a community. The downside is you never know who's on the other side of the screen, right? So you don't know the quality of what that resource or that support is. The more that I do this work, the more that I become convinced that when we think about that array of topics that should be included in sex ed, there should be an internet literacy button on there, because you can end up in such a bad direction sort of accidentally. But that, teaching kids how to get access to good information online is just as important as saying, hey, these are spaces that will not give you good information. So what are the challenges to addressing sexuality? Because there are these gaps that exist, right? So, as I mentioned, there are gaps in learning for autistic adolescents. for LGBTQ plus adolescents, and then for folks who are members of both communities that they feel the double burden of that gap, right? So what drives this? So Dr. Schmidt, one of my colleagues over at BU, completed a review a few years ago, looking at what are the maintainers of this gap. And so what we found were that parental concerns was one, so how to talk about certain topics or not being able to talk about certain topics, and that sometimes falls along the same lines as the topics that schools are comfortable covering. So for example, something like talking about STIs or safety might be easier, but other things like identity, people might not cover. Lack of policies and standards, we saw from that chart a couple of slides ago, that's a really big issue in this area. General characteristic of sex health education. So what is even supposed to be included, right? How do we share that information with teens? You know, if they're not asking specific questions, when do we time this information? Embarrassment, right? This is not always the most comfortable topic to talk about. Okay, so that can be a really big driver of gap in access, especially when we're talking about folks with developmental disabilities, because there's this double stigma with disability and sexuality, which hopefully we are, sort of coming out of as a society, but is still pretty persistent, especially for younger kids. And then limited professional education. Right? I can tell you firsthand, this is my area of specialty. I did not have any classes in sex education for neurotypical or autistic kids in my training program, right? This is something that I sought out on my own after the fact. And when we talk to medical students, they say, hey, I'm probably going to have to talk about this, but I have no idea where to start, what resources I would use, anything like that. So the impression that I'm left with anecdotally is that people want to be able to do this and they want to be able to do it right, but they're not really sure where to start. And accessing quality resources is pretty time consuming because they're not necessarily easily available. But I'll be sharing some resources towards the end of this presentation that hopefully can help us get over that first hurdle and start disseminating this in a better way. So sexuality and relationship education suffers from this phenomenon of what I call, oh, I thought you were doing that. Okay. So when we think of all of these different topics, in our minds, we often have an idea of, okay, I think the teacher would probably cover that. I think, Auntie Sue will probably talk about that. But it's not always explicitly stated until something goes wrong, until you're like, oh, this person has bad information. Or you yourself as a learner were like, I was never taught this. And now I'm in sort of an awkward situation because I have some bad information. So to explore that a little bit more fully, these were questions that we asked about in our online study. So we were surveying autistic adults and neurotypical adults to ask about where you get information across all of these different topics. So I won't go through all of the results of this today, but I wanted to highlight a couple of pieces, right? So we asked, where do you get information about consent? So the big blue piece and the big red piece, that's the internet. Okay. The blue piece is a website of what we're calling verifiable quality. So like a medical website, Planned Parenthood. There's a great organization for autism research website called Sex Ed for Self Advocates that has really quality information. And then the red would be more like first hits on Google. So just whatever pops up, right? Which is potentially not as useful information or perhaps negative information. And the teeny tiny blue sliver in the upper left, the dark one, that is providers, right? So that is people like me, clinical psychologists, pediatricians, speech language pathologists, occupational therapists. So that's a pretty small piece about a pretty important topic. And also one that should take a really long time to learn. And so you would sort of hope that a provider would ask about this at some time, right? And when we think about consent, I like to think about learning about boundaries and sort of private and public behavior when you're little, and that eventually grows into learning more about the concept of consent. Okay, so there's work to be done here for sure. We also asked the same question for getting information about partnered sexual acts. Same pattern emerged. The internet was very, very popular. Care providers, not so popular. And for this one, the light pink up here is parents, which might not be hugely surprising, right? This wasn't different than the rates in the neurotypical group, that talking about partnered sexual acts with parents isn't necessarily something that teens are real eager to do, and perhaps not that the parents are that eager to do either. But The important part here, I think, is the overlap between the lack of professional development, right? We know that most sex ed programs in the US are based entirely on heterosexual, so man and woman, cisgendered, so where their sex and their gender identity are the same relationships, right? So we're learning about essentially penis and vagina sex, and that's it. If you have an identity that is different than that, or you have questions about an identity that is different than that, and if you're trying to make, safe choices, you might simply not be offered that information, even if a sex ed program is offered to you. So that means that folks are turning to the internet here, right? The other big pieces of this pie are, friends, same age, slightly older, slightly younger, or romantic partner. So these could be really positive ways to get information, right? If it's a trusted romantic partner, if your friends are giving you good information. But I think that the mentors, care providers, parents pieces are really small. So when we're thinking about preparing kids for decisions that they're going to make in the future, why are these conversations not happening in these settings? Are there ways we could support, parents, teachers, mentors to feel more comfortable having these conversations and making sure that we're talking about the full range of identities? We're really answering questions that kids might have and giving them information that they might need. So identity and access specifically, let's talk a little bit about why this is such an important topic, especially, all year round, and then we can highlight it in June, which I think is really important. So in 2015, not too long ago, only 12% of students said that their sex ed programs talked about same-sex relationships. Okay. Um, that is not a very high percentage. And in fact, in some states, you are not allowed, it is illegal to mention relationships other than straight relationships. So man and woman, cisgendered men and women together. So we're missing a lot of information here, right? And this does a couple of things. One, for students who are either questioning their identity or already know their identity and know that they need this information, they don't have access to it. It also doesn't model for folks, even if they don't share one of these identities, what sort of that this is but like being normalized by being taught about it, that there isn't just one type of relationship, right? So no mention at all means also where are people going to get information, right? There are, the internet, like as you mentioned, but certainly people who are able to sort of prey on this, right? If people are like, oh, I can give you good information as an older person that you don't really know. So there's some risk in that. So my take on it is always, let's talk about it early and talk about it often and answer questions as kids have them. Regardless of what type of relationship they're asking about, right? Because you don't really know the reason that they're asking. They could be curious and they could be asking about themselves. So it'd be really important to be supportive sort of right away. LGBTQ plus children often have less trusted adults in their life, which in and of itself, right, is a sad stat. That they're less likely to have someone they can go to, sort of a trusted person that could give them quality information. This is also in the sex ed space a challenge because trusted adults are where children get some of their most consistent and reliable sex ed information, someone they can feel comfortable asking questions to. So if you have less access to that resource that's supposed to be a little bit better, that's going to be a problem, right? There's not, how can we increase those trusted adults in kids' lives so they do have someone to turn to? 1 in 5 lesbian, gay, or bisexual patients report that their sexual orientation has caused delays in healthcare. And this brings us back around to looking at whether or not providers feel like they're able to have these conversations with their patients. This is something, our lab also looks at access to healthcare more broadly, sort of like primary care and OBGYN services. We already know that there is a lack of access to helpful or consistent healthcare for autistic adults, right? So then if you're someone who is a member, again, of both communities, and you've got a provider who is not so sure about autism and not giving great information about your particular identity, that's not going to be useful for you. Of course, you would disengage with the healthcare system at that point, right? If you're like, I need to go find other information. So delays in healthcare, that's not good. We want to be able to help people right when they need that information, keep people as healthy as we can. And so we need to be having these conversations with providers, and hopefully there's a few providers logged on today about how we can ask these important questions. And this is starting really basic. Like, are the intake forms in your clinic, do they offer different options for gender identity or sexual orientation? Do you ask about that again when you're meeting with people in your intake, or when you're asking about their activities? Are you assuming like, oh, are you married? Do you have a husband? Right? That's not going to be a good way to phrase some of those questions. So we need to think about professional development opportunities so our provider sources can catch up to where patient needs are. Behaviors versus labels. I love this one as the clinical psychologist because it's a really easy fix, I think, but can also cause a lot of problems. So I've been talking about, using this acronym LGBTQ plus, right? So that people certainly, let's say if they identify as a lesbian, then, or are lesbian, right? Not identify as, pardon me, then that is something, if you ask about, okay, a question about being a lesbian, they can answer that. Some folks, they might not use that term, right? But they might be someone who has sex with women. So for that, if you are in and you're like, oh, like, are you in a lesbian relationship? That's the answer is no, right? If you're talking, but if you're asking, oh, are you having sex with women? And the answer is yes, you need access to the same sexual health information. So this is something that is actually more common in autistic adults to use to sort of define by behaviors rather than labels. And there's a lot of reasons that this could be true across populations. One is that sometimes knowing which term is appropriate, right? Because words, if you haven't been taught what these different phrases mean, you might not know. But the second thing, as people grow and change over time, is that it might be like, oh, well, I used to be this one identity and now I feel something else. And so they might not just be ready to use certain terms or labels. And so really making sure that we're talking about behaviors instead. And that is what we need to know anyway, right? We need to know what, is it having sex with women? Is that the question? And then timing. We, a lot of times in autism education, we're able to take models from neurotypical education settings and sort of pull some of the main structures or models into autism and see how they work. With sex education, there isn't a pre-existing like evidence-based model that we can rely on. So part of what makes sex ed, I think, exciting to study is that there's room for growth for everyone. So even though I study it in the context of autistic communities, it will hopefully help people with other disabilities without autism to really have a better model. And what I mean by that, the timing of different sex ed topics. Too often, sex ed is a class or maybe a semester at some point in middle school or high school, and you're like, okay, here's all the information you need to help you for the rest of your life for all the relationships you will be in. I don't know about you, but that's not my best learning method, right? Some amount of like review and discussion and touching base about, new questions that have come up would probably be pretty important. Also, part of why this is a problem is that we tend to teach sex ed in this country after students need the information. So I think the average is, I believe it's 6 months, but now I can't remember the stat off the top of my head, where when we teach about contraception is on average about 6 months after students have had some sort of sexual activity for the first time. Okay, so we've missed the boat on that. Another good example of that is attraction starts to begin in kids around ages 9 or 10. So they start to have their first crush. They start to think about like, oh, I like this kid in my class. But we're really not talking about identities or relationships until they're a little bit older, right? So could be fine, right? They could get this information from other places, but wouldn't it be better to give them this information earlier so they know, okay, here are some different possibilities, or what am I feeling and why am I feeling this way, and are other people feeling this way, so they can think sort of about how they're developing and going through their day. Okay. I think this is also important. I'm talking about identity, gender identity and sexual orientation, but when we think about any of the topics in sex ed, things like gender and identity is something we start to understand gender roles when around the age of 3, right? But that's not something that we generally talk too much about until kids are a lot older, but they've had a long time when they've recognized them. So how could we fold in those conversations earlier? So what should we do about this, or what could we do about this? So of course I'm a psychologist, so I'm going to be like, oh, self-reflection is a good place to start. It's sometimes a little bit of a stereotype. But we need to examine our own sources of information, right? Without new information, we tend to fall back on our own experiences when not presented with new information. And what I mean by that is that we oftentimes repeat communication patterns that we observed when we were younger. So I want you to take a second, and whether you're here, for yourself or for maybe a kid or a patient or a student, think about how you learned sex ed, right? Who had that conversation with you? About how old were you? What did they start with? You know? Were there topics that never got talked about by, let's say, a trusted adult that was in your life when you were younger? And how did you get that information? And the reason I like people to start there is because we can oftentimes very quickly identify areas where you're like, oh, I don't feel prepared to talk about this because I don't feel like I learned about it in a way that was helpful. And then further, we can identify things that we did not like, how we were taught different aspects of sex ed, and try to improve those really mindfully. Okay. So, both for teaching other people, but then seeking out that information for ourselves. So I think that can be an empowering first step, like examine where you're coming from. And I think again, this could be something you could spend a whole day training on, but that's a really good place to start. Uh, and then building a team. So here is an example. This is something that I've used in trainings previously. But listing out some people in your life who would be good sources of information or might be good sources of information, right? So this is an example we have for a middle schooler where we're talking about parents or family, their teacher, the pediatrician and therapist, SLP, OT, and a psychologist. But certainly, we do this with adults as well. So this could be, my partner, my best friend, my younger sister, something like that. And then we go through and we map out, okay, here are all the different topics related to sex ed that I want to learn about or I want my child to learn about. And here's who I think should cover them. Promoting positive sexual health and behavior gets distributed to everyone, because again, as I mentioned, I run a bit optimistic. And then you take this plan to each of these people and you talk about, hey, teacher, I think, learning about reproduction in school would sort of cover what I think my kid needs to know. Or, if you're talking about, a sibling, like, is this something that they want to talk about with their little brother, for example? And then it's always possible that these, people or roles will say, no, that's not something we cover in school, right? Or no, that's not something I feel comfortable talking about. But then at least you've gone around that issue of oh, I thought you were talking about it, right? You hate to find out years down the line that no one actually had these options. I do want to highlight here IEP options. This isn't oftentimes included in school plans, but if you're thinking about some of the like social emotional learning goals and self-care goals, there are, sex ed topics. If that's something that's important to you, that should be in there, which, of course, I'm going to say I think should be in all of these because it's such an important part of development. That's something to have a conversation with a, teacher or caseworker or something like that. Okay. This can also be a really good time to think about your family beliefs and values in case there are sources of information where someone might be getting information that's different than what you were going to share as a family, or if you're not sure how it will be presented. And so thinking about these early, there's a sort of a second part of this activity, which, we don't have space to go through today, but we talk about timelines. So when would you start having these conversations? And this can be a good time, like with the pediatrician, to get a sense of like, hey, like, we're starting to talk about sexual orientation at home. Like, how do you ask these questions in appointments? Like, what is this, is your office, do they have, pride flags hanging up? What is it? Is it an encouraging environment for people of all different identities or not? And then you can also make some choices about spaces that you're accessing for your kids. And same for adults or teens that are accessing care on your own, right? So I always say as a provider, I make sure that I have books out that talk about sex ed all the time, because even if someone is coming in to talk about a different question or problem, the fact that there can be a really good conversation starter. Printing out that gender unicorn and having that up in your office to show that this is a space where you can talk about these topics, but making sure that you have some of the training and background and comfort to actually talk about those topics in ways that are not harmful. That's a really important second piece of that. So we don't want to be doing it in a performative way, but as a parent or a person seeking supports or medical care, looking for those cues, and as a provider, showing those cues if you're doing the work behind those cues. Okay. So I wanted to talk a little bit about resources, and I'm going to share my screen here in a second just to show you a couple of things. So the first is the OAR Sex Ed for Self Advocates. So this is the organization for autism research, and this is an online program that has both written word and video that talks about a whole range of sex ed topics that was developed with researchers and self advocates together. So I find it very inclusive. I've gotten really good feedback from folks I've worked with who have used this site. This is both meant for self advocates, but also I recommend it to parents who they're like, oh, my kid is coming up on puberty, and how am I going to talk about these? They go to the site, check it out, right? See what you can learn from there, and that way, when the big questions start coming up, you feel like you have a little bit of preparation. There's also the Gay and Lesbian Medical Association maintains a provider directory of providers whose offices and spaces are sort of not only open to but like welcoming of people with LGBTQ plus identities. And so the link to that is in our resource guide, which I can share with you. The green ribbon in the upper right, that is a link to our website. We have a newsletter where we share the updates to the resource guide, and that covers things like sex education training for teachers, if there are webinars, books, social media accounts. So if you're interested, feel free to subscribe on there. And then I really think that hearing directly from autistic folks who have, identities that you're trying to learn more about is the best way to go. And if you don't have those folks in your immediate circle, there are lots of great books. I highlighted a few here. These are just ones that I have in my personal library that I found really interesting. And there are plenty more. And then these names will also be in the resource guide. But doing that work, like reading the stories and hearing from self advocates themselves, really, really important. All right, so let me briefly show you a couple of these to illustrate, so you can check these out on your own. All right, so the first thing I'm going to show you here is, it's called Sex in the States, and this, great, breaks down for each of the states. Click on Massachusetts. A number of important facts, I guess. So sex ed rights. So this is what the state mandates that you include. That's a common question that I get. I don't know what they're teaching at school. This varies so much by individual school and school board. I usually cannot answer that question, but this will give you generally what the rule is in a particular state. It also summarizes LGBTQ rights. Okay, so let's click on that section here for Massachusetts. So here, Massachusetts, statewide laws against discrimination, which is good news, anti-bullying laws, but it highlights there's statewide anti-discrimination laws that include sexual orientation, but not gender identity, right? So when you're filling out that chart or thinking about your own learning, being aware of that might not be included as proactively as information about sexual orientation, okay? There's also a number of other important things here. Age of consent and minority. Sexting is a really big one that comes up in my world and with folks that I work with, because kids don't always realize if they're sending or receiving pictures, what the exact laws are. So this is a great summary of all of that information. Okay. But the links to this and all the other pieces in the resource guide are in that document, which will also be shared after this webinar if you're interested in that. Next, let me pull my slides back up here. Great, okay. And so the one other thing I wanted to show you, oh my goodness, sorry. Let me bring up my other tab. There we go. Okay, this is the Sex Ed for Self Advocates page that I mentioned. Okay, you click on which topic you want to learn about, like public versus private, puberty, healthy relationships. There is a whole section on sexual orientation and gender identity, online relationships and safety. It's like they read my mind. I'm just kidding. I read their mind. I've read their materials. And then once you pop into, let's say we go into sexual orientation and gender identity, there are videos, different sections you can click around. It's very navigable. So I always recommend this, and hearing directly from folks on the spectrum themselves. So there's, I think, a good aspect of sort of community building in there as well. Okay. All right. So let me come back to this. I do want to make sure that we leave some time for questions. So let me just make sure I'm actually sharing my screen here. Yeah, so I want to take a brief moment before we pop into questions, to both thank you for listening and then to highlight a couple of ways that people contribute to our work. So we have a community advisory board. Those are made up of self-advocates and parents, providers who work in the autism world. They give us feedback on how we design our studies and how we interpret and sort of disseminate results. So that critical to the work that we do. So a big thank you to them. Also to our research participants, we have moved a lot of our studies online this year. And so their flexibility in doing that was very much appreciated. But it has been nice to be able to work with folks now from all across the country. We have a different working group of autistic adults for one of our healthcare studies. And we have people in Alabama and California and Massachusetts. So that's been a really nice way to connect. And then the advocates and individuals sort of across history who have done that advocating for sexual rights and for disability rights. We stand on the shoulders of the people who have done this work, and that is really, I think seeing some exciting developments in this area is really a tribute to all the work that has come before. And then a big thank you to Vincent and then Jessica and Beverly, who invited me to come to give this talk, for raising, this, identifying this as an important topic for all of us to learn about. And then a few things if people want to stay in touch, because I know oftentimes, we won't be able to get to all of the questions. We actually have a few studies running that are offering services at the moment. We have an online sex ed program for autistic teens for ages 13 to 17. So that's free and is virtual, so anywhere in the US. That sexuality questionnaire that I mentioned earlier with some of our results, we're doing another round where we're really looking to recruit LGBTQ plus autistic adults to look at how we can improve sex ed access earlier on. And then for young adults with IDD, so it could be autism or intellectual disability, we have an online survey because we need more resources in that area as well. And so that is currently running. But our newsletter is a really good source of additional information, resources, and then we also have social media accounts on Facebook and Instagram where we share some study information, but a lot of resources and events. So webinars like this we would advertise. So yes, that is good for you to sort of keep an eye on. So let me pause there, and I will take some questions. And thank you so much for listening and spending your time learning about this very important topic.
Thank you so much. That was so interesting. I learned a lot, actually. We do have questions flooding in.
Great.
So let me just jump in. We'll do what we can. And then this video will be posted on our website and on YouTube, so people can come back to it and look at your resources and dig in. I sort of love the unicorn, by the way. Okay. So one question is, you mentioned, and I have heard that rates of LGBTQ identity are higher in the autism community. Do we have any quantitative rates on how much higher, and what does that look like?
Yes, we do have that information. There's a big range, I would say. So generally, these data are out of countries where they sort of track at larger scales, like in the Netherlands and Australia. A lot of this work is out of. And so in some studies, it's like 2 to 3 times higher. In some studies, there was one study that came out a while ago that said, it's as much as high as 70% of autistic folks are in the LGBTQ plus community. So I haven't seen that replicated. But the estimate is somewhere between like 3 to 5 times higher. But that ranges a lot. So, and they've also done, and I think this is interesting, like studies sort of in the reverse. So looking at folks who had a diagnosis of gender dysphoria, which is a, there's debate about that term, but when we're pulling medical files, that rates of autism in those populations is higher. So it seems like there's a significant relationship there between gender identity, sexual orientation, and autism. But the exact rates they vary by study. Good
Mhm.
question.
Okay. Um, Another question is, I am working on a safety program for self-advocates,
Hmm.
and sexual health is one of the topics. How
Right.
can I touch on the identity when I do not myself identify as LGBTQ+?
Yes. Right. So that self education piece, so huge. There's lots of great organizations like the there's a whole bunch of them. I won't, I guess, list some of them out right now because they're in the resource guide with the actual links to their websites, which would be more useful. But looking at some of these national organizations that give information about different terms, certainly learning and then listening to self advocates. If you're creating a program and there's a way that you can, employ like a consultant of someone who's on the spectrum or who identifies as LGBTQ plus, that is really the best way to do this work. And I will say we recently put out a call for our working group, and we got many more interested people in serving on the working group than we had capacity to hold. So if you need a connection to an autistic adult who's already interested in doing advocacy work, you can reach out to me, and I can send your name to them in case they're interested.
Great. Terrific. Another question is, are there books you can recommend for children in that 9 to 10 age range?
Oh yes. So like I don't know if they mean sort of sex ed direct books or just like children's stories where there's diverse gender identity or sexual orientation. So there is, oh gosh, let me see if I can pull it up while we're talking. There is a great reading list that I did not develop, but that I oftentimes send to people. So um, let me pull that up while we're speaking, and I'll pop that in the chat.
That would be great.
Yeah. Mm.
Is this reading list for various age groups? So ages 9 to 10 is like fifth and sixth grade.
Mhm.
So is this reading list broken down like by grade, educational
That
grade?
that's what I'm just checking, because I think I want to make sure I'm not sending you like the teenage one, the older kid one, because that won't help. Okay, I'll send the two links in the chat. These look like they might be for slightly older. The first link is actually through Teen Vogue. I'll put it in the chat. There you go. And then, but I think this is the list I've sent around before. Some of these are appropriate for younger kids. And
We'll
again, I
make
didn't
sure.
develop any of these, but these are.
Okay, great. We'll make sure to include these on our website too. So we will put a recording on our website, and we'll include some of these as we get forward. Okay, so thank you for that. Another question is, my granddaughter is 6. I've read autistic girls get puberty at an early age. Is this accurate?
um, that depends a lot on the person, right? So there's lots of factors that go into predicting when kids start to hit puberty. I think actually with all people who might be experiencing, periods and puberty, that we should start talking about that earlier on. I think the more important thing to think about is if you've got, let's say, a young girl who experiences a lot of sensory sensitivities and might be challenged by things like wearing a pad, or the experience of cramps, to start talking about that early. So regardless of when you're able, because we can't really predict when a period is going to start. So I would say yay for talking about it as early as possible, or even just modeling, right? This is something that happens, to me. If you're someone who gets periods, I think is a good outlook.
Okay, here's another one. How can we encourage providers to leverage some of those resources if they seem to be avoidant of these types of topics?
Gosh, if I could answer that question, I would, I would be very happy, is what I would be. So there's a couple things I would say. If you're feeling that you offer them resources and they're being resistant to using them. At a certain point, and I know this is not possible for everyone, see if you can switch providers. Sometimes like it's great to advocate when you can, but also like if you're just trying to get care for yourself, to fight that on battle on two levels is a lot to ask. I think the other thing is that if there's someone else, let's say you're in a pediatrician's office, someone else you can ask about that, and say, hey, like here's some resources I'd like to share sort of with the clinic generally. That can help because then it might inspire another person working there to have that conversation. But because it's really about culture change, and that's really tough.
Yeah.
Yeah.
Okay. Is there a correlation between higher levels of sex education and self-image/confidence?
Oh, yes. So I love that question. Yes. And although I think the exact terms in the studies, it's like um, independence and autonomy or like self-determination, but the gist of it is yes, that the more you learn and are able to navigate sort of your own body, like inside and outside, the more confident you feel about existing in day-to-day life. It also serves a protective, I think, mental health effect, which I mentioned in my presentation. But things like anxiety and depression, if you're not able to express yourself fully, much higher risk of that. But if you're learning through sex ed, about how your body may work or about how your feelings may work, that would translate into feeling more confident. So,
Okay, wonderful. How young and how should we talk to our children about consent?
love that question. So, I'm going to turn awkwardly here for a second and see if I have my cute book here. I do. Okay. So, people have probably seen this before. I don't make a cut of this. This is just something I teach a sexuality and gender and child development course. So, I have a lot of kids' books about this topic. This is a board book, right? Which,
Wow.
yeah, talks about C is for consent, and it's not actually an alphabet book. It is sort of misnamed, but it talks about like, Grandpa wants to give you a hug. It's okay to hug if you want to. It's also okay to not hug if you don't want to, and how to say. So I think that's good to start with early, like having and using specific words and examples, like scripts almost, for how you can say no, because sometimes that's the sticking point. Like kids will know they don't want to hug someone or do something, but they don't know how to say it. And so just saying, oh, no, thanks, not right now. Easy peasy.
Okay, that's great. Okay, we have a few more. If anybody does have questions that they would have a burning desire to have Dr. Crehan answer, please pop them into the Q&A. Okay, here's another one. How can we foster an environment that allows our children to explore their gender identity? You're getting hard questions today.
These are fantastic questions, though. These are good. Um, I think, lots of examples, right? Certainly I could sit here and describe these phenomenon to you, and that's sort of my teaching method, for better, for worse. But with kids, are they seeing examples of different gender identities and sexual orientations in sort of typical ways? Books can be an awesome way to do that. TV shows can be another good way to do that. If there's like a pride parade, that can be a way to do it. So normalizing that in their day-to-day life, certainly having more structured, like, do you know what the word gay is, if they ask, right? Like, okay, well, what have you heard, is really good. But having stuff around, so it's just sort of part of their world, is a good start.
Fantastic. Okay. Although the internet is a good place for information about consent and sexual relationships and identity, is there a way we can encourage our children to go to their parents first?
Yeah. Yeah, I wouldn't necessarily say that the internet is a great place to get information about those two
Hmm.
topics. I think just to clarify, is there a way? So I would say, this is the psychologist side of me. So yes, but it's not going to be straightforward. Right? I think it's like if you have that type of relationship with your kids, so it's not going to be like if you say this magical sentence, then you can do it. I would, have this stuff out and around so they know the door is open. Mention things like, oh, have you heard of the term consent? I mean, that's something that comes up in the news a lot. So sometimes that's a slightly easier way to segue in. Planned Parenthood actually has a bunch of videos which are pretty gender and sexual orientation inclusive, I find, about consent and different examples. So maybe like watching that and having a conversation if you're looking for like a specific seed to plant. But yeah, but having those open lines of conversation, if that's not the communication style you have with your kid, I would say it's probably slightly unlikely that they would open up about sex and
Yeah.
relationships. That's going to be a tough open. But maybe your sales skills are better than mine, and you can go for it.
Okay, we have time for just one more question. Can you provide more information about sex education training for adolescents?
Yes. So there are, like in terms of particular programs, there are a few evidence-based programs. I would say, if there are major autism centers near you or even nearest you to see, many of us are running these online at the moment. So there are sex ed programs available that are developed specifically for autistic adolescents. That tends to be the sort of the target age range for most of these interventions, or like educational programs. I would say, I don't know if that's helpful, but without more information, I think that's my general advice.
Okay. So I think that's all we have time for today. Thank you so much for Dr. Crehan for an amazing presentation, as usual, and to everyone who joined us today.